The Steripath micro blood culture collection system reduces false positive blood cultures by diverting and sequestering the initial 0.5 to 1.0 milliliter of blood, preventing skin contaminants, when present, from entering blood culture bottles. The following video tutorial demonstrates proper use of Steripath Micro for peripheral venipuncture. Collect the necessary supplies, including Steripath Micro, with either the 21-gauge or 23-gauge BD Vacutainer Ultra Touch push-button blood collection set. Perform skin surface antisepsis according to your institution's established guidelines. While skin antisepsis is air drying, prepare bottles for sample collection by placing a visible mark above the broth corresponding to the amount of blood that will need to be collected, if not using pre-marked bottles. Be sure the bottle is level prior to measuring. Thoroughly disinfect each bottle top with an alcohol prep pad. Scrub for 15 seconds, let air dry, and leave a new pad on top of the bottle. Open Steripath Micro, keeping the device on sterile packaging to prevent contamination. The integrated transfer adapter is secured in place and does not need to be tightened. Ensure site is completely dry. Perform venipuncture following standard procedure. Consider securing the site as needed. Insert the blood culture collection bottle into the integrated transfer adapter to divert initial specimen of blood into the C-shaped diversion chamber. Monitor blood flow into diversion chamber until it is full. Fully depress the button on the side of the diversion device to lock in potential contaminants. Depressing the button on the side of the diversion device automatically switches the Steripath Micro to collection mode. Continue to inoculate the blood culture bottle and fill according to institution guidelines while holding bottle level. Fill each bottle to visible mark. Visible foam is not considered part of sample volume. Gently agitate bottles several times to prevent clotting. Follow the same procedure for inoculation of second bottle. Be sure to gently agitate bottles several times to prevent clotting. Inoculate any additional samples for blood work. The slide clamp can be used to occlude the tubing as needed. Lastly, dispose of supplies according to institution policy.